Hello, this is case number 172-40524 with a history of skin problems. And so this is our first SRT analysis. I'm going to go over the results with you. So I wanted to explain a little bit about SRT. SRT means stress resistance testing. And what is resistance? Well, the best analogy, one of the best analogies is to think about a wire circuit. So the more resistance in that wire circuit, the more heat or inflammation, the more heat's going to occur in the circuit. So that's equivalent to inflammation. Another analogy is we have a normal roadway here. As long as we keep it between the lines, we reach our destination healthy and happy. But there's an opportunity to go off the roadway, and there's a warning sign. That's the bumper pad along the roadway. And that's analogous to acute stress. So if we're going off onto the bumper, it says, well, that's a warning, a caution that, okay, we've got a 50-50 chance we're going to get it back on the roadway, or we're going to go off in the ditch and be sitting there. So the ditch indicates chronic stress, which can lead to a condition called dis-ease. The body's out of balance, and then it can lead to more chronic disease problems over here. So if we take this case, we look at genetics plus environment. Environment equals genetic expression. So when we're exposed to things in the environment, the genetic code is going to react a certain way. Because it's supposed to, and every individual is different. The problem is that over prolonged stress, it changes the body's biochemistry and leads to more chronic problems. And so if we come down here, in this case, if we look at the 5 elements, the heart, the GI tract, lungs, kidney, and liver, the heart has a relationship to circulation and behavior. The stomach is analogous to anything digestion. The lungs have a relationship to the skin. The kidney for urinary habits, and livers for detoxification. So in this case, we change food. So that's a digestive change. Causes itching. Leads to an issue with the liver called liver yang rising, which causes restlessness, and then the behavior of scratching. If we kind of expand on that with the SRTs, we're looking at no chronic stressors because we're still a fairly young dog yet. But at the same time, what were the main takeaways? Well, acid-base balance. The more acidic the body, the more changes are going to occur with inflammation and skin issues. So acid base was the underlying stressor coming off onto the bumper here, but all it took was a change in food to set it off. Also, an interesting fact was pure water contaminants. And that's a chemical response. A couple of other things that showed up were chemicals. So the chemistry of what we're being exposed to sets off a chemical reaction in the body, changes the acid-base balance, and all it takes is a change in food to set it off. So you have these underlying factors there, but it's a simple change of food, and we often will mistake that food for maybe a food allergy, when in fact we had all these other potential stressors, and the food was the trigger for it. So the goal is, with the calibrated hemp oil, is that we're going to restore this acute stress here back into the roadway. So we have normal healing response. So the body can balance itself, reset its biochemical response. And so then we're less reactive to changes in food. But we can also choose a food that's going to be most appropriate for them. So how do we do that? Well, we use the calibrated hemp oil, 5 drops a day. Use that for the minimum of 3 weeks. Maximum of 3 months the first time around. Now our response in that window of time is, after 3 weeks, how are we doing? After 3 months, how are we doing? If we're back to normal, then each season there may be changes. There again, being a young dog, that we're looking for ways to manage and to adjust for the changes in genetic expression up here that the environment provides with environmental exposure, the genetic expression that each patient has inherited from their parents or their parent line. So often these skin problems are inherited, but it takes environment to actually set it off. It takes underlying stressors to be the trigger, and then one simple response, a change in food, can set it off. So hopefully that makes sense to you. So look at the SRT report. What I like to look at is the abnormals. There should be a page that you received that's just abnormals. Kind of really review those, watch the video, explanation, and it's going to formulate more questions, because then we can have another video conference or we can actually talk over the phone. Thank you.